At a time when the world is deeply involved with the Russia-Ukraine conflict, crises in several other parts of the world are being totally overlooked. One such part is the Horn of Africa. In this video, we'll talk about the Horn of Africa hunger crisis. Here is a map of the world's second largest continent, Africa. Look at its northeastern region. This horn-like landmass is called the Horn of Africa. The four countries that you can see here are Eritrea, Djibouti, Somalia and Ethiopia. This region is facing a major food and health crisis. As per the United Nations estimates, over 3.5 crore people in this region are facing acute hunger. The Horn of Africa has a history of acute food insecurity. Food crises are not uncommon in the region. The region is known for its poor performance in the Global Hunger Index. Because of multiple failed rainy seasons, this region is facing its worst drought in more than 40 years. Yet for some reason, the mainstream media does not consider it necessary to talk about the crisis unfolding in this region. Pastoralist communities depend on livestock for sustenance and livelihood. Around 1 crore livestock have died across the region because of the drought followed by below average rainfall. The region may face famine. Getting access to water is nothing less than a challenge. There is not enough water for drinking, cooking, cleaning or sanitation. The taps are drying up. There is a huge risk of waterborne diseases and infections. Cholera and measles are on the rise. Health systems are inadequate. Local community-based humanitarian organizations are leading the drought response and saving lives. Yet it is not enough. The worrisome health situation calls for immediate international attention and support. Due to the food crisis, children are going hungry in the region. In Somalia alone, more than 50% of children under 5 years of age are facing acute malnutrition. Significant increase has been reported in children dropping out of schools. As per the World Health Organization, the food crisis in the region is leading to a health crisis. Severe malnutrition and decreased access to health services is resulting in the outbreaks of infectious diseases. According to UNICEF, undernutrition weakens the immune systems, thereby resulting in increased frequency and severity of infections and delayed recovery. Low existing vaccination coverage and health service availability worsens the situation even more. The combined impact of exogenous shocks like the Russia-Ukraine conflict, regional strifes, climate change and COVID pandemic has resulted in inflated food prices as well as difficulty in accessing food. The region is dependent on agriculture imports from Russia and Ukraine. For instance, Somalia relies on Russia and Ukraine for more than 90% of its wheat supplies. Apart from wheat, food items such as barley, sunflower oil and soybean come from these two countries. The war has disrupted the trade and supply chains. The region had not yet recovered from the ill effects of the pandemic, and it got hit by rising food and fuel prices, inflation, financial instability and declining currency. People are forced to spend a majority of their income on basic nutrition and are being left with almost no savings. This situation increases the tendency to purchase low quality food, having lower nutritional value, which is detrimental to health. The Horn of Africa is itself one of the most conflict-affected regions of the world. You must be aware of the armed conflict in Ethiopia's northernmost region of Tigray. Regional strifes destabilize the region and lead to the displacement of people, diversion of essential humanitarian supplies, thus increasing the fragility and vulnerability of the populations. Logistical and security challenges obstruct the help and access to affected people. The 2022 Hunger Hotspots report of the Food and Agriculture Organization and the World Food Programme states that organized violence and armed conflict remains the primary driver of acute food insecurity in the majority of the hunger hotspots. Not only physical health, but mental health is also taking a toll. Trauma and grief is being deeply ingrained by the people, which, according to a preliminary study by the UN, could lead to an increase in psychological disorders. Further, it is also necessary to talk about the social implications of the food crisis. Because of the shortage of food, families are forced to make desperate choices like marrying off their young girls, as marrying them reduces the number of people required to be fed. A horrific data reveals that child marriage has more than doubled in the worst drought-affected regions of Ethiopia. And in some cases, the groom is above the age of 60 years. Because of all these reasons, cases of intimate partner violence and sexual assault are on the rise. Rising temperatures due to climate change are making drier regions drier, thereby increasing the risk of drought or prolonging the period of drought. In such a scenario, women are forced to walk further to obtain a basic resource like water, which increases their vulnerability to sexual violence. Therefore, women are facing dangers to their health and aggravated risks of gender-based violence due to the food and water crisis. African countries often face inequality in global aid distribution. This was evident in the COVID vaccine apartheid that they were subjected to. If we wish to strengthen resilience in nutrition and food security across the region, we must proactively address the inadequate international response and funding deficit in the region at the earliest. A good thing that I remember is that India has spearheaded the proposal to declare 2023 as the International Year of Millets. Millets require less water and agricultural inputs and are a traditional food that is consumed by the African people. An urgent, immediate, and coordinated action from the global community is the need of the hour. Governments, international community, agencies, civil societies, and humanitarian organizations must come together and act now.